sure now that I got the hernia doing a bicep curl. I couldn't remember before for the life of me, but it just dawned on me this morning. I was doing this curl and I was going real heavy on the weight that I just felt something slip.
Once you're diagnosed with a hernia, it's always a hernia. This is nothing that can be treated medically. It is treated surgically.
A hernia can happen to anyone at any age. 50% of all middle-aged men will develop a hernia in their lifetime. Approximately 600,000 hernia repair operations are performed in the United States annually. Stay tuned for an informative look at hernia repair. Learn how they develop and why surgery is needed as we take you in the OR to meet the surgeon behind the mask. This is OR Behind the Mask.
I've been going on my military career about 8 years now, and the heavy part of the workouts have been primarily running. We do a lot of running, a lot of calisthenics that involves push-ups, sit-ups, jumping jacks, things that you can do that doesn't require the use of a lot of equipment or, requires the use of a gym or facilities.
Jerry Regis is active with the Army Reserve and proactive with his personal fitness workout program.
About a year ago, I decided to change my workout program and decided to incorporate, free weights, strength training machines, just to kind of put on some size, put on some mass, not so much bulk up and become some sort of, Mr. Olympia, but at least to look well-toned and a little bit more proportioned for my physique. I believe I got inguinal hernia by my heavy ab workouts. I think a combination of crunches and man makers and, sometimes when you're in the gym, you try to become a little bit more creative than you should be. And that probably aggravated the condition more. I first realized that something was out of the ordinary when I was in the shower. I noticed a slight bulge in the pelvic area on my right side, and I said, well, this is normal. It's definitely something that deserves the attention of a doctor. I went to see my family physician, and after a checkup there, and I showed him the bulge, of course, and he said, yeah, it's inguinal hernia, and it's a condition where the abdominal wall makes a small tear, and he recommended that I go see a surgeon for a second opinion.
Jerry's physician recommended that he be evaluated by Dr. Frank Campisi, a general surgeon of Orlando, Florida.
Jerry presented with a complaint of a bulge in his right groin, and I examined him and found that he had a right inguinal hernia. What this is a sac that contains intestine. In a male, it's mostly going to be intestine. It can also be appendix. In a female, it can be ovaries, and it can also be bladder. You can develop a hernia a number of ways. You may be born with a weakened area in your body, or as time goes by, your body weakens. As an older man, most likely he'd be working heavy job or doing exercise, and a part of his body that's just generally weakened, like your bones weaken, your abdominal wall can weaken and allow this hernia to develop.
Like all hernias, Jerry's tear or hole in the abdominal wall will not go away on its own.
Jerry's case was that he was working and he does exercise, and most likely a combination of his work and or exercise allowed the hernia to be recognized. He might have had a small hole that gotten weaker over time, or actually born with it, but most likely in his case I would think it would be exercise and work related.
Ironically, movements like these don't aggravate my system as much as, say, sneezing or even worse, blowing my nose. But when I blow my nose, now that really pushes the intestines right through the abdominal wall.
Now think of your abdomen as a large compartment with a sturdy outer wall, like a tire, and a thin inner lining like an inner tube. When the outer wall weakens or tears, the inner lining pushes through and forms a bulge called a hernial sac.
The reason we treat hernias is that the organs that are internal are suspended on blood supply, and if those organs get compromised, if they get stuck in this hole, they get twisted around, they lose their blood supply, it's essentially the same as having a heart attack. The blood to the heart is shut off, the blood to the intestines in this case would be shut off, and complications can then occur. So we try to fix hernias just because they're there, just to avoid problems. The size of the hernia doesn't make a difference in most cases. Sometimes bigger hernias are actually safer than smaller ones. If something gets stuck in a small hole, it's difficult to what we call reduce or go back.
The development of the tension-free mesh technique that Dr. Campisi uses has reduced post-operative pain and recovery time and virtually eliminated the chances of recurrence.
This is a proline mesh. It's an extremely strong substance, and if it's non-absorbable, meaning this will stay with you for the rest of your life. If I anchor this into tissue that's strong and I put under no tension, the chances of your hernia falling apart again is almost nil. You can't pull this apart. What we do is we put your cord structures after we fix the hernia back in its normal anatomical position and then sew this closed. So this hole that was there before is no longer existent. And this actually acts as a net. Anything that's coming from underneath now will get stuck. Your body will grow into this. So besides it being strong material, not being able to be pulled apart, your body adds another layer of strength into it by growing into it over a period of time.
In 5, 4, 3.
Jerry's full-time career is in broadcasting, where he works as a network floor director.
You know, one of the best things that I love after the surgery is done and getting my hernia corrected will be just getting back to work and being able to do the normal things. Even right now, I have to be careful what I move, what I pull, what I do.
Jerry's outpatient surgery will be performed at Sand Lake Hospital in Orlando.
I have no apprehensions. I feel completely safe. You know, Dr. Campisi really inspired some confidence there, but I want to get it done. I want to go through my recovery time. I just want to get back to the gym.
I've just seen the patient explain to him what we will be going through in the next hour and what his initial post-operative course will be like. So what we'll be doing today is doing an open standard, what's called Lichtenstein operation with a proline mesh.
In a moment, Dr. Campisi will perform Jerry's hernia surgery.
Recovery post-operatively is very individual. There's a normal biological healing process for wounds, and most people are well on their way within 4 to 6 weeks. However, with the mesh technique that we use, the repair is extremely strong immediately. In Jerry's case, he's a young, healthy male. He should be back to work within a week to 10 days doing at least light-duty work. His post-operative course should be uneventful. He will see me within 1 week after discharge from the hospital, which was the same day of surgery. He'll be up and around, and as long as he's not medicated, he can be driving and walking and acting as normally as he feels that he can. Pain is very individual post-operatively.
Guess I'm all done. I've had my surgery. Don't feel half bad.
If you suspect you have a hernia, see your doctor right away for a medical evaluation to accurately pinpoint your problem. You and your doctor can work together to determine the best time for hernia surgery, which will help prevent complications and enable you to resume an active life. For anyone who is in need of surgery, advancements in modern hernia repair have alleviated any cause for anxiety.
Yeah, I'd recommend to anyone having it done. You know, first of all, it was painless. After a couple days, that's gone. Why not get it done? It was on an outpatient basis, so I was home the same night. Also, it's that peace of mind that comes with it, knowing that, hey, I got this done. In a few weeks, I can get back to my regular physical activities. I don't have to think about, am I pushing myself too much? And to anyone, I'd recommend having it done.